This is Caring for Kids on News Talk 760 WJR. Presented by the Children's Foundation. And here's your host, President and CEO of the Children's Foundation, Larry Burns.
Well, thanks, Mark, and hello, everyone. Welcome to Caring for Kids, August edition. Hopefully everyone is having a good summer, even among this COVID-19 environment that we're all living in. And more importantly, I hope everybody is well and taking care of each other. Tonight, we got a great show. We're going to be talking to some of our newest partners at the Children's Foundation. And joining us first is Kathy Donovan, Chief Executive Officer at Children's Hospital of Michigan, our original partner and our great partner today. And then Greg McLaughlin, Chief Executive Officer of both the PGA Tour First Tee Foundation and the World Golf Foundation, is joining us, and they indeed are a new partner of ours. And George Kikano, who's the Dean of the Central Michigan University College of Medicine and Vice President for Health Affairs at my alma mater, CMU, Central Michigan University. And it's all coming up next on Caring for Kids, here on the great voice of the Great Lakes, News Talk 760 WJR.
It's Caring for Kids with Larry Burns.
All right, welcome back, everyone. Larry Burns here, Caring for Kids, August edition. Summer is going by too quick, for me at least. On the phone is Kathy Donovan. Kathy was named Chief Executive Officer at Children's Hospital of Michigan in June of this year. She has more than a decade of healthcare administration experience, including her most recent positions as Chief Operating Officer and Chief Nursing Officer at SSM Health Cardinal Glennon Children's Hospital in St. Louis, Missouri. Kathy has been a nurse for more than 30 years, with most of her professional career spent in the field of women and children health services. Kathy has a strong background in operations, patient care, driving growth, major capital improvement projects, strategy development, and designated patient care ancillary services. So, Kathy, welcome to Caring for Kids.
Thank you so much for that introduction, Larry. I appreciate it.
Very impressive indeed, and welcome officially to the Detroit area. You have over 30 years of experience working in leading children's hospitals across the country. And what really attracted you to move to Detroit, become the CEO of our great Children's Hospital of Michigan?
So caring for my community has been such a large part of my life. And as you pointed out, my entire background is in women and children's services. So it is a passion that is deeply rooted and goes back 30 plus years. I'm married to a fire chief, so our family focus has been to care for our community and how do we do that to the best of our abilities. So I'm extremely passionate about the impact that healthcare can make on a community and how important it is for the survival of the community. So I was drawn to CHM in the Detroit area because of the opportunity to truly make a difference on the impact of the care of the kids in this town and throughout the entire state of Michigan. We're all obligated to do more in the care of our most vulnerable patients, right? And those are our kids. And that extends well beyond the walls of just the hospital. So encompassing the entire community and focusing on what needs to be done here is really what attracted me. It's things that I've done in my past, and I really feel like I can make a difference. Some of those things would be getting kids to primary care visits, focusing on good nutrition and exercise programs, health education, addressing the behavioral health needs of this community, just to name a few.
Yeah, and those that you name happen to be our focus areas as well. So our relationship with the Children's Foundation and your hospital, the Children's Hospital of Michigan, will continue to be very strong moving forward. So we're very excited about that.
Us too, for sure.
And so I know that children's hospitals are much different than adult hospitals, and I think most people would sense that, but don't really understand some of the major differences, particularly as an administrator, in your case, as CEO of a leading pediatric hospital. And so tell our listeners just some of the things that they should know versus an adult hospital and your hospital, a pediatric freestanding children's hospital.
Yeah, children are extremely unique and require very specialized care. They're not just little adults, which sometimes is the misperception. So each child that we treat could be one in a million cases seen across the country. They're so very specialized, and they require such a large multidisciplinary team to work with them. Yesterday, we were talking to one of the senators, and one of our patient stories came through, and this child has 12 different subspecialists that help in his care. So it takes a very special healthcare worker to also commit their lives to care for kids, because it's not easy to watch kids go through this. One of the main differences is they're innocent in all this. Kids, don't control most of the things that happen to them, and so we need to protect them and advocate for them. And also in the pediatric medicine circle, you care for the entire family. It's definitely a multi-D approach, and it's family-centered care. So each child could be surrounded by both sets of parents, grandparents, their siblings, and you really need to integrate all of that in the child's care. Most kids have multiple subspecialists that treat them, which adults do too. But like I said, one child could have a dozen different specialists. And the thing that's so unique about the Children's Hospital of Michigan is we have all those subspecialists at our fingertips that we do not take for granted. These are physicians that could work anywhere, and they choose to be here, and we're so appreciative of that.
Yeah, that's outstanding. And it's every area of the hospital, including pharmacy. I've learned over the years that giving prescriptions to a youngster is far different than, as you said, just making them a little adult. And so in every area of your hospital, treating kids is different than an adult. So thanks for that explanation.
Absolutely.
So we're talking with Kathy Donovan, who's the CEO of Children's Hospital of Michigan. And now, Kathy, you've been in your position a few months now. And what are your thoughts about the Detroit market? I know you're living downtown, at least temporarily, and some of the observations you've been able to make so far, and then talk a little bit about some of your short-term goals and objectives for the hospital.
Short-term goals for me right now are, how do we return to business while living in this new normal? We all know the impact that COVID has had on our entire country. The healthcare industry was hit particularly hard. Healthcare has always been recession-proof until now. And so we're trying to figure out, how do we emerge from this and get back to business while keeping everyone safe in this new environment. Kid emergencies don't pause for a pandemic or anything else. Kids tend to have more emergent needs. So we need to be here for our community and figure out, how do we keep our patients, families, and staff safe and open back up for business. The other piece of this in the short term is, how do we support our staff who have gone through something that you would never expect, right, in your entire lifetime? And this will have lasting effects on the staff. It's a different type of burnout. It's a different type of post-traumatic stress. And so working through something completely new in terms of, how do we raise up all the folks that came together and did such a beautiful job working through COVID and caring for this community. Longer-term goals, I really want to focus on building deeper partnerships with the community and coming together to make a difference on the impact, the biggest areas of need. So we used one of the examples earlier, behavioral health partnership with community organizations, coming together with other children's hospitals in the state, and also with you, Larry, and the Children's Foundation of how do we really move the needle on this. Working together with the other children's hospitals in the state on advocacy, and really coming together across the state to fight for the needs of kids and having a united voice. And then gaining national recognition for the care that goes on here in Michigan. We do some incredible, innovating, cutting-edge research here in Michigan. How do we elevate that to a national level and gain the attention that Michigan deserves on that stage? We're so very proud that we were ranked once again in U.S. News and World Report. We ranked in 6 different subspecialties this year, but this just goes to show the type of care that goes on here at the Children's Hospital and what sets us apart from all the other guys. These are nationally ranked subspecialty physicians and clinics, and we have really rose to the top of our game with it.
Absolutely, and it's something that we're very proud, too, to be your main partner in research, certainly along with universities and the faculty, but the Children's Foundation continues to be committed to not only supporting programmatic services at Children's Hospital, but also to be a leading supporter of clinical research in particular, which is so very, very important for a children's hospital like yours. And so the other thing I want to just emphasize is the mental health focus area, that I'm so delighted that you're going to join us in that initiative. And as you know, we're trying to put together a collaboration of organizations within the state to create a facility that would be a facility that kids and families could utilize once they've been stabilized, maybe in an ER. And with that, have you seen any increase with COVID-19 in behavioral health either ER visits or just things that you've seen that maybe weren't evident prior to this?
Yes, absolutely. It's not a far leap to understand why kiddos who are challenged with behavioral health issues already, or some that are being newly diagnosed, they're experiencing things that they've never experienced in their life. So they're isolated. They don't have a normal routine. They're not out seeing their friends and even their extended family right now, which is contributing to some of their behavioral health issues. And so our volume has increased dramatically in our emergency department for these kids and parents who are seeking some refuge and some treatment for this. And as you pointed out, Larry, the need is post that emergency room department visit. So where do these kids go to receive the longer-term treatment that they desperately need? And that's what we're going to work on together.
Absolutely. Looking forward to that. And so last question, kind of a fun question, is what has surprised you the most regarding either Children's Hospital or your moving to Detroit, regarding things that maybe you didn't expect? So anything fun there?
Yes, I have fallen in love with Detroit quickly. It's very similar to St. Louis, which it feels very much like home to me. And Detroit is such a big sports town, which I absolutely love because that mirrors my passion. So, what I have found, most probably not surprising, but fulfilling with the Children's Hospital is the pride and passion that the staff have and the physicians have, that they demonstrate on a daily basis. This is highly skilled staff that could work anywhere, but they choose to be at the DMC and the Children's Hospital because of their commitment to this community, and they're so very passionate about our kids and taking good care of our kids. I'm really humbled by this, and I'm so honored that this team chose me to help lead them, through our future and to bring us to another level. And having seen the resilience coming through COVID and coming out on the other side has been so energizing for me. Folks are ready to just get back to work and take great care of our patients and our families in this incredibly challenging time. Everyone has hung in there with us, which I think is just incredible.
Yeah, well, we're delighted that you're here in Detroit leading our main partner, the Children's Hospital of Michigan. And people need to know that you are serious about your commitment to Detroit, because one of the things you told me a while ago is that you became a Detroit Lions season ticket holder.
Yes, we did, and we were so disappointed when we got the call saying that, it was going to be limited fan participation. So, the listeners need to know, though, I am a huge St. Louis Blues fan, and we are the reigning Stanley Cup champions.
Oh, yeah, well, we'll probably edit that. But no, the fact that you're now a Lions fan is going to be very important. So, Kathy Donovan, thank you so much for what you're doing at Children's Hospital of Michigan. We're delighted that you and your husband and family are going to be Detroiters, and look forward to keeping in touch on caring for kids.
Larry, thank you so much for having me. I appreciate you.
Okay, thank you very much. Coming up next, we're going to talk to one of our new partners, and that's Greg McLaughlin of the First Tee, the national office, when Caring for Kids continues right here on the great voice of the Great Lakes. News Talk 760 WJR.
Welcome back to Caring for Kids on WJR, presented by the Children's Foundation.
Welcome back, everyone. Larry Burns here, Caring for Kids, August edition. Kathy Donovan was our first guest. She's great, leading the Children's Hospital of Michigan. And we have a new partner in Greg McLaughlin. Greg is the Chief Executive Officer of the PGA Tour First Tee Foundation and Chief Executive Officer of the World Golf Foundation. Prior to these roles, Greg served as President of the PGA Tour Champions and was CEO of the Tiger Woods Foundation. As president of First Tee, Greg is responsible for strategic direction, executive management, advancement and promotion of the organization's network of over 150 domestic and international chapters, delivering youth development programs to more than 5 million young people annually at more than 1,200 program locations in all 50 United States. So, Greg, welcome to Caring for Kids. And I mentioned that you're a brand new partner of the Children's Foundation, and we're going to talk about that in a few minutes. But I wanted to ask first and give our listeners a view of your background. You have a great background in so many different aspects of the golf community. So tell our listeners what brought you to First Tee and how you see the future of First Tee and your involvement developing over the years.
Well, thank you, Larry. It's an honor to be on your show today. My background, I'm probably 30-plus years working in the golf space and also in the not-for-profit industry, having run PGA Tour events in various parts of the country, on both in California and certainly on the East Coast as well, with each one of them being focused on not-for-profits. And the PGA Tour model really is all the money that's generated goes to support charities. So all the organizations are 501c3s. And then in 1999, I went to work for Tiger Woods to help him and his dad start the Tiger Woods Foundation, and was there for probably about 15 years or so, where we reached out to young people using golf as a platform to introduce kids, but it was really more focused on educational resources around science, technology, engineering, and math, mainly in Southern California and then also in Washington, D.C., so very regionalized in those two markets. And I came to work at the PGA Tour in 2014, headed up the PGA Tour Champions, which is the over 50 circuit. I did that for about 4.5 years. And then at that time, I had been discussing with the tour, and then the tour created the first tee in 1997. And the goal really at that time in the creation of the first tee was to use golf as a platform to introduce kids to the game, but then also teach them life skills and character education related programs. So it was certainly far more than a junior golf program, and it intrigued me because you've got a great organization that had been around for close to 25 years that reached 15 million kids in all 50 states. And there's some 20,000 people that are associated, like yourself, that are connected, either staff, board, volunteers. It was kind of new construction for me, mainly because I was employee 5. And when I started there, we had $500,000 in the bank. And when I left, we had 60 employees and $150 million. Wow. That we had amassed over a 15-year period. So it was a good run, as they like to say. And I viewed this as really more of a transformation, because the first tee had done so many wonderful things in its 25 years. And now the question is things have changed dramatically in just education and youth and how we communicate today as compared to 1997 when it started, and certainly in light of what's happened in the last 6 months in our world. So the question is how do you propel this organization for the next 25 years, so it can sustain and continue to grow.
So tell our listeners a little bit about maybe some examples of the life skills you mentioned that First Tee is also trying to share with youngsters through golf. And so I think that's important, particularly for the Children's Foundation's involvement. So can you give us a couple examples of that?
Sure. I mean, all of our programs are delivered by trained instructors. And every one of them have gone through varying levels of training in order to deliver this, what we kind of like to describe it as a youth development character education program. One of the interesting things about character education, you're really not born with it. Character is something that you just develop through your life through, various experiences as part of it. And our sweet spot of focus is really on what we describe as the 10 to 14-year-olds. So let's say 4th grade to 8th grade, and the goal being is that you get kids ready for high school. Because high school, the transition from either elementary or middle school into high school becomes a pretty significant transformation in an individual's life, and getting kids ready to deal with those variety of challenges as they go through high school. And then before you know it, they're on their way to college and then in the workforce are really critical. And we have kids, of course, that continue to participate in the program through high school as well. But our goal really is helping, develop these young people through the various, values. We have our 9 core values where we offer a little lesson for each one of the kids as part of it. And then oftentimes I'll attend events and kids will talk about the 1 or 2 core value that resonated, exclusively with them. So it's really a program that we're very proud of. And then we really offer, since 2000, we've offered a school program where at elementary and middle school, the First Tee is introduced and really through a physical education class. And we probably reach somewhere in the neighborhood of 3 million kids annually through our school program. It's pretty significant outreach. And that's an introduction. And then what we try and do, obviously, is connect the kids from the school program to the local chapters. And then if you look at after-school programs, youth-serving organizations, Boys and Girls Clubs, YMCAs, and similar programs, we probably have another 1,200 of those. And then our next wave really for us is going to be more of a push into technology. We've done a nice job relative to technology, but we feel like that's an opportunity long-term for us to be able to reach, more kids as part of it. And again, going through the pandemic,
Right.
I mean, we're talking about schools right now and how they're educating our kids across the country, and it's something that is certainly needed, and we think will be an excellent tool to what we're going to do as our future and next wave from a resource standpoint.
So one of my favorite questions to ask you, Greg, is the Children's Foundation. We recently announced our affiliation a couple of weeks ago. We did that at the headquarters of the Detroit Pistons. We did that because one of our major donors is a major player at the Pistons, as you well know, and a national board member. And so tell our listeners what brought you to want to be talking with the Children's Foundation regarding this affiliation in Greater Detroit.
Yes, our announcement was very exciting, and we thank Arn Tellum, who's president, not only the Detroit Pistons, but the Detroit Pistons organization, who's one of our trustees, as well as Roger Penske, another fellow Detroit resident.
Right.
We thank both of them for the support really that they've done supporting us. The outreach that you all have had in reaching out to young people has been extraordinary, and the reputation that you have in that community in and around philanthropy was exactly what we were looking for in a partner. We think Detroit has a tremendous appeal and opportunity, and we think that we've done a great job in the past there, but we feel like the Children's Foundation can extend that reach. We made a big push. Currently, the First Tee on a national basis is about 39% gender diverse and about 52% non-Caucasian. And that's a big focus, for us, is being able to provide our programs into underserved and underrepresented communities. And, we think Detroit offers a tremendous opportunity and partnering with the Children's Foundation. And that gives us great excitement. And we think a great opportunity, certainly for the Children's Foundation as well, to expand your footprint in that marketplace and continue to do, more great work.
Absolutely, and it truly is a partnership. And so I know in the next week or so that you and your staff are going to announce and launch a new brand for First Tee. Tell us a little bit about that before we wind down.
Yeah, I mean, the brand, it began with a logo review, which, typically these things begin with that. It's the original logo for 23 years. And as we started really going down that path, it really became more of a review of a brand identity. And the thought process there is that, what do you want to be known for? What do your constituents believe that are the most redeeming qualities within your organization? And how do you communicate that? And that was the process. If you ask most people that aren't informed of what the First Tee is, they'll all have name recognition, incredibly high name recognition, probably through the PGA Tour and advertisements that appear on the 1,000 hours of network coverage that the tour does, on an annual basis. But most of them will say, a junior golf program. But if you ask people that are connected with the program, they'll tell you that it's really a youth development program. And the unique thing about the youth development side of this is probably 90% of every dollar that comes in to the First Tee National and at every one of our chapters is from individuals that care really about youth development, more so than they care about junior golf and teaching kids to play golf. So the focus for us really is a concise message on how we communicate who we are really to the world. And that's really the main focus with it. And as part of it, it's a relaunch of the brand, which everybody kind of focuses on. And we tried to find something that was a little more kid-friendly that kids want to wear. So we brought a group together. We had an external brand company out of New York that did the legwork for us probably for about a year or so. We started on this. This process has been going on for about 1 year, and they interviewed and had a bunch of kids really from the New York, New Jersey area that helped them at least create something that ideally that they wanted. So we're excited about it.
Yeah, we're excited about that. So I know that we'll be hearing more about that. And Greg, I want to thank you for all the things that you've done in our conversations for the last many months and your leadership, making our partnership actually happen. And we're extremely excited from our board down to our staff, and most importantly, the kids that we are going to serve. So thank you so much for what you're doing with First Tee.
Well, Larry, you're very kind, but we owe you the thanks and your team in bringing this to fruition. And we only hope that we can get together in person very soon. I think one of the last meetings I ever had was with you and your team. I mean, it was like, almost that quickly. So again, we're excited and thankful to everything that you guys are doing, and excited about our future as well.
Great. Thank you. That's Greg McLaughlin, president of First Tee and the Children's Foundation's newest partner. Next, we're going to hear from another new partner, Dr. George Kikano, who is the dean of the Central Michigan University College of Medicine. That's when Caring for Kids continues right here on the great voice of the Great Lakes, News Talk 760 WJR.
Welcome back to Caring for Kids on WJR. Presented by the Children's Foundation. Once again, here's Larry Burns.
Well, we're rolling along here in our August edition, and now we have actually in studio, and in this COVID-19 environment, that's odd, but we're delighted to have Dr. George Kikano right next to me. Dr. Kikano is the dean of the Central Michigan University College of Medicine. He's been in that role since July of 2015 and became the vice president for health affairs in August of 2018. As Vice President of Health Affairs, Dr. Kikano is responsible for the unification of all CMU health-related programs, functions, and clinical services, as well as aspects of regulatory compliance, quality information, security, privacy, and all of the things that are important in his world. He also serves as chairman of the board of the CMU Medical Education Partners. Dean Kikano is passionately committed to teaching. He's committed to community partnerships, that I know firsthand, access to care, and the college's mission to educate diverse students and train culturally competent physicians to provide comprehensive health care and services to the underserved populations in Michigan and beyond. Makes CMU's College of Medicine very special. Dr. Kikano remains a practicing family physician. He is the recipient of several awards and was recognized as a healthcare hero by Crane's Cleveland Business. Dr. Kikano, welcome to Detroit. Welcome to Caring for Kids. Dr. Kikano, as a proud CMU graduate, I've been extremely interested in the evolution of the College of Medicine at CMU. And can you give our listeners an overview of that process and maybe most importantly, where the school stands today?
Thank you for the question, Mr. Burns. As you know, our country has been facing a major shortage of physicians, and there's major shortages happening in urban, rural, underserved areas. Conservatively, we're looking at over 50,000 physicians needed in this country in the next 10 years. It takes over 10 years to produce a physician. They go from high school to undergrad to medical school to residency program. Right. So the problem that we're going to have in 2030 starts now. So based on that mission, based on that need, the leadership of Central Michigan University over 10 years ago decided to open a medical school with a mission. And there's nothing more exciting to build something new that's with a mission.
Right, that kind of mission particularly.
Absolutely. So this is where Central comes. So our mission is to provide a workforce of physicians for the future to take care of underserved population within urban and rural areas. And our footprint has been Michigan. We are a school for Michigan, from Michigan. To that extent, by choice, not by need, 80% of our students have been selected from Michigan, and we are hoping, based on the data, they'll do the residency in Michigan, they'll stay in Michigan to take care of urban, rural areas. With over 7,500, close to 8,000 applicants we have on a yearly basis now for 100 positions, again, by choice, we select students from Michigan because there's higher likelihood they're going to train
they'll stay
absolutely.
In Michigan. Yeah, that's terrific.
And this is all mission-driven for us.
Yes, and we're talking with Dr. George Kikano from CMU's College of Medicine, where he serves as dean. And I worked at a medical school, as you know, for a number of years in Toledo. And one of the things that we always were excited to learn each year was match day, where the graduates find out where they're going to do their residency. And that sometimes can be a barometer of how the school's doing. And so how are the graduates doing and where are they going? Hopefully, as you mentioned, they're staying in Michigan, but some of the other places they might be going.
That's a great question. I mean, we graduated 4 classes so far. Our match rate and match records have been almost perfect, which is amazing for a startup, a brand new startup. But because of our graduates, where they match, what they did, the number of residency programs that are seeking them out, we established a track records now for more applicants coming to seek us out because of the success of our graduates. At a very high match rate, very close to 100%. Over 50% of our classes has stayed in Michigan, and the other ones are being recruited nationally in one of the top programs in the country. We are proud of them. The other statistics I'm proud of, because of our mission, 75% selected the primary care specialty.
Yeah, that's big. That's important.
As you know, Mr. Burns, we put a lot of emphasis on mental health. Out of a class of 100, our current fourth years, 16 of them will be going to psychiatry.
And that's unheard of for most schools, yeah.
16% of medical school go into psychiatry.
Yeah. And so, as you know, the Children's Foundation, Dr. Kikano, is very committed to mental health, as you mentioned, and your commitment to mental health from the perspective of the graduates and of the students. And you've also created a residency program, correct?
Actually, this is part of a larger vision to improve mental health in the region. This is even if you large urban areas where you have large healthcare system, mental health is still a bottleneck. In our region of the world, to get an appointment with a mental health provider for a new patient, it takes over 6 months to get that.
Yeah.
That's unacceptable. We have children being locked up in the emergency room for mental health issues. They're there for 2 or 3 days to find them a bed somewhere else.
Right.
As a country, as a community, as a state, this is not acceptable. So to meet that mission, 5 years ago, we started a residency program in psychiatry, the only one that's up in the middle of the state and north of the state. Last year, we're fortunate enough through state and federal funds to start a child-adolescent fellowship for that. So one good example of our mission, our first class of graduates from our psych residency program, which had 4 residents, 3 out of 4 stayed in the region.
Yeah,
that's
so
mission
very
for
much
us.
Needed, yeah.
The other piece of mental health that's been great for us has been all the relationship and the linkages we've done with local mental health agency. These are grassroots organizations to address suicide prevention, suicide education, stigma around mental health, geriatric health. So we invested more in partnership as well as education and the physician workforce to meet the need of the community.
Yeah, and as you know, we're all about partners. I think it's one of the reasons that we're so excited to work with you and your colleagues at CMU. We have over 100 partners now, as you know. We are now in Mount Pleasant. We're in Saginaw. With your help, we're in Flint. We're in Traverse City. And so we have a bright future together. And speaking of bright futures, you have a growing relationship with the Children's Foundation and also the Children's Hospital of Michigan and University Pediatricians. And so can you tell our listeners a bit about that partnership?
In most communities outside urban areas, there are very few pediatricians, there are very few pediatric subspecialties. That creates a bottleneck for student teaching around pediatric issues, whether it's just primary care pediatrics, subspecialty, pediatric mental health or so. And that's a problem not just for Central Michigan, it's a problem for all medical schools in the country. So the opportunity to partner with a freestanding children's hospital, which is Tenet CHM, as you know, downtown Detroit,
right,
the patient they serve, as well as an outstanding group of pediatricians of all specialties who have been teaching for over 50 years, the ability to partner both with the hospital and that pediatrician group to able to provide opportunities for our students to get educated around pediatric issues in a strong urban area, could not pass on it. So it's been a great partnership so far, and we're hoping, in the next few years to enhance our partnership, to add other elements to it besides education.
Yeah, so one of our partnerships that we're working on together with you and with the Children's Foundation and the hospital is we are fortunate to have a very generous donor who created a new endowment for psychiatry at Children's Hospital, and we're going to be working on that together to find the first endowed shareholder of that. And I know we're going to use your expertise in finding that person.
Our commitment is to get the best first-class person anyone can get. We're going to have to house them in Detroit to take care of children and families with mental health needs. So I appreciate your support. I appreciate the partnership we have with the University Pediatricians and the Children's Hospital of Michigan. Watch and see. We're going to get the best person we can.
Yeah, absolutely. We're going to work on that, and we'll have that person on Caring for Kids, too. So lastly, the College of Medicine is still relatively new. And where do you see your vision? I know you are a visionary. And where do you see the College of Medicine being maybe in 3 years, 5 years, and in 10 years? If you could give our listeners a view of that.
Pre-COVID, we had big plans. I feel that COVID put a halt on things for us for a year. We're proud to establish the team we have. I'm fortunate every day to work with a great team at Central Michigan University, within the College of Medicine, as well as the university at large. We have a very strong educational foundation. We established a brand. The next phase for us over the next 3 and 5 years is to develop and invest in research that's meaningful to take care of the communities. I know we're not looking at just the basic science piece of it. We're looking at the clinical translational, things that can improve the health, This is mental health, physical health, economic health of the community. We're going to make an impact on the communities we serve over the next 5 years. And from there on, we are hoping to expand our class size, develop more interprofessional teaching, and have more partners in Michigan and beyond.
Yeah, well, that fits exactly what we're doing. I mentioned we have over 100 partners now. We're in the mid part of the state. We're in the northern part of the state. And together we're going to do a lot of great work over the next several years. Is there anything else you want our listeners to know about CMU, the College of Medicine, and what you're doing up there in Mount Pleasant, Saginaw, and beyond?
We are mission-driven. We support. We have funds available. In my position, I have funds available. I have people asking for money. We just invest in programs that fit our mission.
Yeah. Awesome. So our mission and your mission work together so well. So thank you, Dr. Kikano, for being on Caring for Kids.
Thank you for all the support, and thanks to the Children's Foundation for the great partnership.
It's our pleasure, and we're looking forward to a bright future. And so that was Dr. George Kikano, Dean of the Central Michigan University College of Medicine. And coming up next, I'm going to provide an update on some foundation news, as I usually do, and it's right here on the great voice of the Great Lakes, News Talk 760 WJR.
It's Caring for Kids with Larry Burns.
Well, that was a great show, everybody. Hopefully you enjoyed listening to some of our new partnerships and new partners. So we got a lot going on at the Children's Foundation. As we'd like to do at the end of each show is talk about some of the upcoming events. We mentioned last month the Paul W. Smith Golf Classic. Paul W. was actually on the show. I'm delighted and proud to say that it was a huge success, the golf outing, the 17th annual, and we were able to raise more than $426,000 net. Paul loves for me to say net, $426,000 net for 4 great charities, of which the Children's Foundation is proud to be one of them. We're also very busy planning to host our 4th annual Derby for Kids event at the Fabulous Country Club of Detroit in Grosse Pointe Farms, Michigan. That will take place on September 5th, the day of the Kentucky Derby this year. We have a great silent auction, live music from my good friend Alexander Zonchek and his band, the Motor City Horns. We have a special performance by a great Rod Stewart impersonator. He's awesome. I've seen him. Proceeds from this event really help a multi-institutional pediatric cancer research initiative. And I'll mention real quickly, it would be Mott Children's Hospital, the University of Michigan, Wayne State University, the Children's Hospital of Michigan, and Hurley Hospital in Flint. So it really is a wonderful integrated research project. So please help us with that. To learn more about it, just go to our website, yourchildrensfoundation.org. And the Jamie Daniels Foundation is planning to host their 2nd annual Roast of Scotty Bowman. And it will be a virtual event this year. It's going to be on October 14th. Details are coming together quickly as the committee meets every week. And that's the JamieDanielsFoundation.org is the website, JamieDanielsFoundation.org. And it's a great organization dedicated to educating people about opioid abuse and helping people in recovery. So thanks for listening. We appreciate it. This is Caring for Kids, sponsored by the Children's Foundation. Be safe, stay healthy, onward.
Caring for Kids with Larry Burns on WJR has been presented by the Children's Foundation.